Living with pain is not something anyone ever plans for. Pain is something that often sneaks up on us when we least expect it. So, what is the difference between acute and chronic pain, and how does the approach to treatment differ? Well, I'm about to tell you, so stay tuned and find out. So one thing we need to keep in mind when we're talking about pain is a symptom, not a diagnosis. Acute and chronic pain of the musculoskeletal system take on very different characteristics. For example, acute pain would be more related to like a traumatic injury, such as a car accident, sports injury, or a fall. Chronic pain can be very insidious, though often presents with sudden onset without known cause. It can be very hard to diagnose, and often is related to degenerative disc disease, degenerative joint disease, and osteoarthritis. The patient may be feeling fine one day and the next day just roll out of bed or bend over to pick up an object, and all of a sudden their back goes out. Something had been going on for a while before that event occurred. When we're talking about the physiology of acute pain, the tissue is relatively healthy except for the injured tissue and is much easier to diagnose because we have a known event that caused the injury. The physiology of chronic pain can be more related to degenerative changes of soft tissue due to poor diet, systemic inflammation, and underlying pathology such as cancer, diabetes, and autoimmune conditions. It is the moment that we experience pain that it becomes a symptom. And like I said, pain is a symptom of something deeper happening in the body. A thorough history and physical exam can tell me a lot as a doctor. This guides me to know my next step in helping my patient get better. Some solutions come easier than others, but a solution is always the goal. Getting to the root of the issue is key in moving the patient toward a better tomorrow. In terms of traumatic injury, we have a known cause. Our goal is to treat the immediate injury by reducing inflammation and inducing healing without suppressing the immune system. We can use a common acronym known as RICE, which stands for rest, ice, compress, and elevate. This often helps to reduce inflammation, reduce the swelling, and induce healing. Remember, when we have traumatic injury, there's already acute inflammation in that area. We don't want to give an NSAID, steroid, or any medication they may suppress the immune system ability to heal the injury. In terms of chronic pain, treatment would consist of first identifying an underlying cause and treating the patient accordingly. An example of this might be peripheral neuropathy. As a physician, the first thing I would look for is a metabolic cause, such as diabetes mellitus. This condition commonly occurs in these patients, and basically what it is high blood sugar that causes damage to the peripheral nerves in the hands and the feet. We'd also look for something possibly neurological that may be the cause. Screening the patient for an underlying condition is very important in these cases. In addition to addressing the underlying cause, the damaged tissue must also be addressed. Imaging is often an important diagnostic tool in helping me as a doctor know exactly what we are dealing with and in choosing the appropriate treatment approach. Acute and chronic tissue damage can have similar treatment approaches. However, some treatments such as prolotherapy would be contraindicated in an acute injury. Stem cell or stem cell derived products such as allograft can be given to both acute and chronic tissue damage. The reason for this is because Stem cell and stem cell derived products have anti-inflammatory markers which help to reduce inflammation while inducing healing. In the case of prolotherapy stimulates an acute immune response to induce healing. In an acute injury, we already have that acute inflammatory response, so we wouldn't want to induce more of that with a prolotherapy type treatment. Now, once we treat an injury, it's very important to set the patient up for success. And what I mean by this is when we treat injured tissue, it is important to teach the patient how to prevent soft tissue injury in the future. In terms of traumatic injury, we may teach the patient proper form, such as in the event of a weightlifting injury, or maybe help them to know what kind of supportive devices they can use, such as maybe a soccer player, to prevent knee injuries in the future. In terms of chronic injury, we want to make sure that the patient is managing their underlying condition. For example, in the case of diabetes, we want to make sure that the patient is managing their blood sugars and monitor blood work to ensure that the A1C is staying within normal range, or at least relatively close. In terms of an autoimmune condition, we want to make sure that we're keeping the antibodies low and the patient is not experiencing spikes that will go on to do more damage to soft tissue in the body. So each video in this 14-week series consists of points from my book, The Pain Solution. The Pain Solution is more than just a book. It's a recipe for life. How many people actually feel empowered to navigate their own health care and cure or prevent disease? My goal as a doctor is to empower my patients, not place them on a never-ending treadmill of sick care. Pharmaceuticals should be a last resort to treatment. The earth provides a cure for everything that ails us. We have been conditioned to believe that we need a pill for every symptom, ache, or negative thing that we feel. Mindset plays a major role in the outcome of the patient's healing journey. It's time to start facing the feeling and recognizing it for what it is, because the way you feel is something you have control over. You must start feeling healthy before you can experience wellness. You must start feeling free before you can live without limitations. And you must believe in yourself before you can be believable. The choice is yours, 100%. What choice are you going to make today? I will put a link in the description below if you're interested in purchasing the Pain Solution. You can purchase it from Amazon. The paperback is $34.97, or you can purchase it directly from me. I will personally autograph it and mail it to you for no extra charge. I am Dr. Victoria Munoz, CEO of Regenerative Sports Medicine and Anti-Aging. Until next time, take care.